So first comes the skin grafts. You should know, first of all, what is a skin graft, basic difference between skin graft and flap. So skin graft is just a epidermal and dermis tissue, which is taken without its blood supply, and it obtains its blood supply from the wound bed. Skin graft can be of two types. It's a split thickness skin graft known as STSG, or full thickness skin graft. Split thickness skin graft comprises of epidermis and some portion of dermis, whereas full thickness skin graft comprises of complete epidermis and the dermal component, not the subcutaneous tissue. So as you can see in this picture, split thickness skin graft again is divided into thin, intermediate, and thick. So thin means generally it is 0.2 to 0.3 millimeter thick. Intermediate is 0.3 to 0.45. And thick is 0.45 to 0.6 millimeter thick. So this is for MCQ purpose. Okay, you should remember thin, intermediate, and thick split thickness skin graft. Split thickness skin graft is also known as Thiersch graft, and full thickness skin graft is known as Wolf graft. Again, for MCQ purpose, remember these two terms: Wolf graft and Thiersch graft. Right? In full thickness skin graft, even the dermal appendages, okay, that is the sweat glands, the hair follicles, the sebaceous glands, they all come into picture. Whereas in split thickness skin grafts, these dermal appendages, they get cut off and they are not seen in the donor area. Now, the important thing which you should remember is how does graft uptake happens. So there are three phases. First is the imbibition phase. Next is the inosculation phase. And the neovascularization. Okay, in imbibition phase, what happens is when you place the graft on the wound bed, so the wound bed is always prepared with good granulation tissue and good blood vessels. So in first 24 to 48 hours after placing the graft survives via diffusion of oxygen and nutrients from the plasma. Okay, that is why it is known as plasmatic imbibition phase. Post imbibition comes the inosculation phase, where the capillaries, they bud from the wound bed. Okay, they coapt with few vessels which are present on the skin graft. Okay, this is known as kissing capillaries. So they both form a vascular network and provide blood supply to the graft. Okay.